Don't you just love it when the CDC publishes verifiably false information? Well, the CDC, in conjunction with the World Health Organization, put out a press release overestimating the number of children at risk for measles by 14 million due to missed doses of MMR vaccine in 2021. Don't they realize that when they put out demonstrably false information, that all it does is tarnish their reputation further? Hasn't their reputation been tarnished enough already the last couple of years? Let's talk about it. Hey everybody, it's Dr. David. So the CDC at the end of November put out a press release with the following headline. Nearly 40 million children are dangerously susceptible to growing measles threat. Now, first of all, what is dangerously susceptible? There is no such medical term. Google it. Look it up. The only time you will ever see this phrase used is in reference to this particular press release. Yes, kids could be susceptible, but dangerously susceptible? You're either susceptible or you are not. But at the same time, what are they doing? Are they trying to just get more attention for the story? Are they trying to scare the public with numbers that actually are not actually correct? Well, this is what they're doing right now. So here's what the story is. Of the 40 million doses that were missed, 25 million were in kids who missed their first dose. And of course, if you didn't get any vaccine for measles, MMR, which is the vaccine we've been talking about, and if you haven't had measles before, you're susceptible to it. But 15 million of those children missed their second dose. Okay, now the CDC themselves say that 93% of children who get their first MMR vaccine are protected already. So only 7% of those kids are not protected if they miss their second dose. And furthermore, 4% of kids will gain benefit from that second dose in terms of protection, but 3% of the population will still not be protected even if they get the second dose. Okay, so if you do the math, that means 14 million out of those 15 million children who had a missed second dose are not susceptible, let alone dangerously susceptible. But at the same time, they're being quoted, or they're quoting themselves as saying that that's not true. You know what? I'm pretty good at math. I knew my numbers. As soon as I saw this, I knew that this wasn't right information. Now, this is not to downplay the potential dangers of measles. Over 300 children in the world die of measles every day, and 20% of American children who catch measles are actually hospitalized. So again, I'm not downplaying this. And furthermore, my children have been given the MMR vaccine, so of course they've had titers to show that they don't need the second dose. But still, this is a serious issue. But gosh, let's get our data right if we're trying to present it to the population, to the public. Now, what they then say is that, which children do not need to be vaccinated. Okay, so first of all, they say the children do not need a vaccine if they've had measles or lab-documented proof of immunity. So, of course, now we're talking about titers, which, as you may know, something that we routinely check on any child who has had their first dose. And if the parent wants to, of course, if a parent said, just give my kid the second dose of an MMR, of course, we will adhere to their desires, because that's what about what choice is all about. But of course, if they, in our practice, we check to see if they need it, and our numbers fall very in line with the CDC's own published data. Okay. Now, the same is also true in terms of protection for mumps and rubella, although the protection levels are not the exact same for those two, but they're still very protective overall in terms of the numbers. So, of course, we check these titers all the time, and at our practice. So I have a simple question. Why is that not standard of care? Why are we giving a vaccine at a second dose prior to kindergarten when only 4% of the population will actually benefit from it? Why is this not standard of care? Why are all pediatricians not offering a vaccine titer for measles, mumps, and rubella so that the family will know whether the kid actually would benefit from it in the first place? So again, I can only speak for myself and what I do. It's kind of sad that this isn't part of the general conversation that happens as part of the before school entry physical exam and making sure that their vaccines are up to date for the school purposes, etc. But of course, that's just where I'm coming from, but apparently not everybody. So anyways, that's my take on this. Of course, if you haven't subscribed to this YouTube channel, please do so. Join us on our other social media platforms. Join us on Patreon if you want to further support our work here. And of course, watch as many videos as you can so that and as well as share it with others so that everybody has this type of information. Have a great day.
You like what you saw? Watch another one. Click right here.